am a student nurse at CLC. Can you tell me your name and date of birth?
Yeah, Phyllis McCracken, 317XX.
All right, that matches my MAR, and your MR number also matches. So how are you feeling today?
I'm really nauseous.
You are. So your doctor did tell me that, and he did prescribe an NG tube to be placed. So we are gonna go ahead and move forward with that after I do a little assessment on your abdomen. But first I'm gonna also check your IV site, okay?
Okay.
Alrighty. So I'm gonna look at the bag, and it is 5% dextrose and 0.45% sodium chloride, which matches with my MAR number. I'm looking at the tubing, and the IV was started 3/8 at 1600, so I don't need to replace any of the tubing. And the expiration date is 4/24, so I know that is all good. I'm gonna check the tubing, and there is no kinks. It is at 42 milliliters an hour, which is what the physician ordered. I'm gonna check the tubing here. Alrighty. And then I'm gonna look at the actual IV site. And is there any pain, Phyllis?
No.
I see no edema, and no redness. I'm gonna check for the temperature above and below. And there is, it's all warm and dry. Also, it is not cloudy, the bag, so that is all within normal limits and perfect. I'm also gonna listen to your lungs, okay? So I'm gonna have you take a few deep breaths for me.
Okay.
Alrighty.
I'm gonna take a picture and tell Becca. You think yourself.
Alrighty, fellas, few deep breaths. Alrighty, now I'm gonna have you sit up, okay? And we're gonna listen to lungs on your backside, okay?
Okay.
Alrighty.
You ready? Yes, you could be, but you're not, so come on.
Awesome. And notice no abnormal lung sounds, no crackles and wheezing. I'm gonna check for edema. Do you have any allergies, Phyllis?
No.
Okay, awesome. So I'm looking for edema. I'm feeling there's no edema. I'm gonna check for capillary refill on the toes, and it's less than 3 seconds. I'm also gonna check down the fingers. It is also less than 3 seconds, which is all perfect. Alrighty, now I'm gonna do another assessment on your abdomen now, okay?
Okay.
Alrighty, so I'm going to listen to your abdomen first, and then I'm gonna feel it, okay?
Okay.
Alright, then lift your gown up. Alrighty, and listen to all 4 quadrants. The bowel sounds are hyperactive. I palpate now. And it is feeling a bit distended, so we are gonna move ahead with that NG tube insertion, okay, Phyllis?
Okay.
Okay, I'm gonna get everything set up. I'm gonna raise the head of the bed if that's okay with you.
Mm-hmm.
To a 45-degree angle. It's right there. And I'm gonna raise the bed to a working height. Alrighty, Phyllis. So I'm gonna get everything set up, okay?
Okay.
So what I want you to do is that throughout this procedure, if you are feeling any pain, I want you to raise your hand because you're not gonna be able to talk.
Okay.
Also, while I'm getting everything set up, can you close one nostril and breathe in and out and do it on the other side as well? Which side is easier for you?
The right side.
Okay, so we will insert that NG tube in the right nostril, okay?
Okay.
All right, I'm also gonna check if there is any obstructions in your nose and your mouth. You'll see nothing in the nose and the mouth as well, which is perfect. So now I'm gonna go ahead and measure this, okay? So this should help with your nausea, okay?
Okay.
So first what I'm going to do is I'm going to inject your
Alrighty, let's go ahead and measure this out. Alrighty, so I'm gonna measure this from your nose to your ear and then to your xiphoid process. Okay, Phyllis?
Okay.
So nose to your ear and then down to your xiphoid process.
Okay.
So I'm going to mark this off. Alrighty, and then before I continue, I'm gonna check the suction to make sure it is working. It's gonna be on continuous suction, and I'm gonna check to make sure that it's suctioning against my finger, which it is, which is perfect. Okay, now I'm gonna put this in here.
Yeah, so I've heard you've been throwing up and stuff. The doctor
Okay. Now I'm gonna apply a little lubricant
decrease the nausea
and explain what's gonna happen. Here's some water for you. You're gonna need that. So what's gonna happen is I'm going to insert the NG tube into your right nostril because it's the one that is patent. And then when it gets to the back of your throat, you're gonna put your head forward. But initially, you're gonna have your head back. Okay? And then when it's forward, I want you to swallow some water. So then you're gonna swallow the tube and make sure that it's not going in your airway. Okay?
Okay.
Make sense?
Yep.
Alrighty. Remember that if you're in pain, raise your hand. Okay?
Okay.
Alrighty. So I'm gonna have you tilt your head back.
We also have our start date on the IV. Okay, so your IV is good.
Alrighty.
Just gonna check
Go
the
head
suction.
forward,
Make sure it's working. Continuous
all the way to the tape. Alrighty.
check over there.
And I am going to
Next, really
secure
quick,
this
just
to your
gonna check
nose.
lower extremities in your feet for any kind of swelling, okay?
Okay. Now I'm gonna check for placement. And I do see bile, which is normal.
No swelling, no edema.
Alright, now I'm gonna clamp this and attach it to the suction. Alrighty, I see that it is suctioning, which is perfect. Now I'm going to attach it to your gown. You feel alright?
Yeah, a little nauseous still.
Okay. So I'm gonna attach this to your gown.
Checking suction. Suction's good on the container. Alright, now lift up your bed.
Alrighty, this way you can move around without tripping over that if you have to get up, okay?
Okay.
Alrighty. So I am noticing that it did stop suctioning, so I'm going to go ahead and check for placement again, okay?
Okay.
We'll go to your abdomen where you're nauseous, okay? Now put this up to you. When I put it down, you have to take a deep breath in and then out. And in.
Alrighty. So I'm just gonna clamp this NG tube, attach the piston to it, and now I'm checking the placement. So I'm gonna draw back. I see bile, but there is a bit of resistance. So I'm gonna push that back in, and then we're gonna do another assessment on your abdomen, okay?
Okay.
Sounds clear, no cracking.
I'm gonna throw this out. Okay. Now I'm going to raise your gown and listen to your bowel sounds. And all four quadrants again. Okay, so they still are hyperactive. I'm gonna palpate. Your abdomen is also a bit distended. So your doctor did order that I could flush if needed, so I'm gonna go ahead and move forward with the flushing, okay?
Okay.
Alrighty. So I am using 0.9% sodium chloride. It was open 3/8/24 at 1600, so it is not expired because it is within 24 hours of opening. So I'm gonna go ahead and pour 60 milliliters. Alrighty.
I can see
And now I'm gonna clamp this,
no major protrudences or
grab the suction.
really bad, but we go ahead.
Alrighty, that way no stomach contents will pull out, and then I'm gonna drop 60 milliliters. Okay. Put that there. Now I'm going to clamp this. And attach the piston. Now I'm gonna flush, okay, Phyllis?
Okay.
So you do have hyperactivity in all 4 quadrants of your valves, which is right here.
Okay. Now I'm gonna pull back. There's much less resistance, and I see bile again, which is perfect. I'm now gonna attach it again to the suction.
So with the NG tube, we're going to be inserting a tube in through your nose. It's going to go down your esophagus into your stomach. We're going to hook up to the suction canister, which is going to pull out all that, the bile and
Okay.
fluid.
So now it's attached to suction, and I see that there are stomach contents being suctioned, which is perfect.
No.
I'm just gonna do one more reassessment of your abdomen, okay?
Okay.
Everything's good. Are you feeling better?
Oh, yeah, feeling much better.
Okay, perfect.
Take a deep breath in, okay?
Alrighty. I'm gonna pull your gown up, and I'm gonna clamp the suction so then I can hear.
Good. Okay, which room is
Listen
working?
into all 4 quadrants.
Okay. So the right one has proper patency, so we're going to be going down that notch.
Okay. Bowel sounds are normal active, so it seems to be helping. I'm gonna palpate.
This is across the chest.
Your abdomen seems to be a lot less distended, so I believe the NG tube is working perfectly. Alrighty. So I believe you're done. I'm gonna lower you down. So you are gonna have to stay seated up, just so then you don't aspirate any of your stomach contents into your lungs, okay?
Okay.
Are you comfortable like that?
Yeah, I'm comfortable.
Perfect. So your call light is right here. So if you need me, please don't hesitate to call me, okay? And I will be back in about 30 minutes to reassess you, okay?
Okay, thank you.
Alrighty, thank you so much.
Also, it's going to help